welcome back. I hope you enjoyed that interview with Dr. Kieran Ward from the University of the West Indies Chemical Engineering Department, a young man who is doing great things, but who is leaving our shores in search of better opportunities. I want to say, we have produced a lot of people graduating from the University of the West Indies as bachelor's level graduates. We've produced people at master's level. We've produced people at PhD level. And we have a research infrastructure at the University of the West Indies that is quite significant. You would also recall from my conversation with Professor Prasad yesterday that there is also a significant research capability being developed at UTT as well. And with the consciousness that is available now, people are not doing research for its own sake anymore. And you need some of that. There's nothing wrong with that, because that's how you figure out what is the next problem that you have to create. I always remember, when I was at the University of Chicago, I remember a professor telling me that the more important than the answer to something that you are trying to find out about are the questions that you come up with that will lead you to look for deeper answers. I always remember that. And I always remember I did a program at Oxford University once at the business school. And when I was there, I remember a very distinguished professor coming in, and he indicated that what we are doing at Oxford is not what we are doing at Oxford University in programs such as these, is that we are looking for the next generation of questions, because the next generation of questions are the questions which will yield answers that will drive the world and the world economy. So never underestimate the value of conversations and value of asking people questions and trying to get answers, and never undervalue the things in your own mind that allow you to question things. I spent a lot of time in my life talking and trying to convey the idea of how important critical thinking is. And critical thinking is not a big thing. It's just that it has to do with the fact that you see the world as it is, but you don't accept the world for everything it is. Because if you didn't question the world as it is, you would never get to the world as it could be. And therefore, a critical assessment of the reality surrounding you, the life around you, the things around you, these things are essential for making progress. All right? And it really was a joy to talk to Dr. Kieran Ward there just now and to have that conversation. I try to have not a question and answer interview, but a conversation with people. And as I said, these conversations are about development and hope that we learn from each other. I learn from my guests, they learn from me. And I hope you learn from the conversation as well, whether you're listening on radio 97.5 or whether you are looking at television, MCTV. All right, and we thank you for listening and viewing. We thank the support staff here in the studio for making this program possible. We thank the sponsors who support us, and there are more people willing to sponsor now. We are very happy for that. And we also thank you for viewing, because the viewing audience is growing and the listening audience is also growing too. So we thank you, because we are building a learning community here. We will learn from each other, and the more we know, the more we understand, the better we'll be able to exercise the business of citizenship. So a democracy depends on this. Democracy depends on learning and engagement and discussion and collaboration. We have on the line now Dr. Lackram Bodoe. He would be no stranger to you. He is a member of Parliament in his second term in Parliament. He used to be head of the SWRHA, chairman there for many years. He's a very well-known and distinguished medical practitioner in South Trinidad, and we will have a discussion with him this morning. Is Dr. Bodoe on the line? Dr. Bodoe, how are you?
Hey, Bhoe, can you hear me?
Yeah, I'm hearing you now. Yes. How are you doing?
Good morning to you. I'm doing fine. I just wanted to say good morning to you and your listening and viewing public, and to congratulate you on your new show, Brighter Morning with Bhoe. Well done.
Thank you. Thank you very much, and thank you for coming on. So I'm going to start with what you, as a medical practitioner, very knowledgeable in your field, dealing with patients every day in another area, and a person who understands the public health system, because you have worked in it as well, and you've held a leadership position there. When you look around you at this time at what is happening in the health sector, what are some of the things that you see are positive, and what are some of the things that concern you about what is happening in the health sector at this time?
Well, Bhoe, I just want to say that the challenges that the health sector has faced over the past 17 or 18 months with the onset of COVID-19 have been unprecedented. And therefore, we have to examine the health sector in that context at this time. Of course, the biggest problem remains the COVID-19 and how government and citizens are dealing with COVID-19. And of course, the current topic on people's minds is the issue of vaccination, and of course the arrival of the Delta variant. So those are really some of the issues. But in addition to that, what we are seeing, while governments and authorities and so on focus on COVID-19, I am also seeing that there is a challenge in the treatment patients receiving or not receiving in some instances in the regular healthcare system. And that is something that is of tremendous concern to me. I see this both as a medical practitioner in my field as well as a member of Parliament. Only yesterday in my constituency office, I would have had two patients, one whose cataract surgery has been postponed on several occasions and is yet to get a date, and her vision is worsening. She's getting blind while she's waiting on a new date for her cataract surgery. And the other patient awaiting an angiogram for heart disease. So those are some of the issues that we face in the regular health system. So we have two issues. We have what is happening with the COVID and the management of COVID, and the challenges that the government has faced with COVID, and how the government has treated with that challenge. I think we have the issue of vaccinations on the table. As you know, that had been a problem for quite a while in terms of the vaccine vacuum that existed, but now that seems to have been replaced with what some are calling vaccine hesitancy, and of course the ongoing challenges in the regular health sector.
Okay. Well, we will get to the health sector and the challenges there because the minister was here earlier this week and I asked him, how is all of this COVID focus affecting the health system? And he did admit that, there was an issue of resources, but that many of the things that were essential were being managed, and he particularly talked about the maternity issues, and later on we had somebody talking about the fact that nearly 300 pregnant women who had actually been infected with COVID had safe deliveries, and we had our first mortality in that area. So that there's no question that there is some pressure on the system. But let's talk about this thing. Has the government handled the COVID vaccination? We had this problem where we did not have vaccinations for a little while, and I don't want to go back there because it's finished, but we now have vaccinations, and we are on a mass vaccination drive now. Is the government handling this well, the mass vaccination, in terms of resources, when you take into account the extent of resources we have and the division of labor between a COVID focus and the rest of the health system? That's the question I want to ask you. Is there something
Well, I think the challenge we're facing now, Bhoe, is that we actually have sufficient vaccines. If we were to count the 800,000 Sinopharm vaccines that are in the country, and I believe the latest figures would show that just over 200,000 people have been fully vaccinated, and I believe perhaps around 400,000 people have received their first dose. Now, we know that we need to get maybe about 700 to 800,000 people vaccinated. We're looking at 70% of the adult population, and I'll come back to speak about the issue of children in a little while. But at the moment, the vaccines that are available, as we know, are just for the adults. So we are really way behind in terms of reaching our target, despite the fact that we have sufficient vaccines. And one has to examine as to why this is so. I believe the government did make some mistakes in the early rollout in terms of planning and so on. One remembers that disaster with the walk-in vaccination that happened over a couple of days. We've gone past that. But really and truly, what has happened is that the planning for the rollout seemed to have faltered a little bit. Now I think we might be in a better place. The vaccines are here, there are sufficient centers and so on available. In terms of the health centers being available, the mass vaccination sites, and so on. So really and truly, the government needs to examine why it is that we have this so-called vaccine hesitancy. Is it because of the poor communication? Is it because of a lack of communication strategy? I see now that there are ads being taken out and so on. We have some prominent citizens, cultural icons, religious leaders and so on being taken on board, and hopefully this will make a difference. But I still think that we are not there as yet. And really and truly, one would have thought that the vaccine uptake would have been a little bit more at this point in time.
Yeah, I am very disappointed with the numbers. Less than 450,000 with their first dose and under 300,000 with their second dose, possibly about 250,000. I really think we should be farther along than that. Do you think that the issue of, what we had a situation of vaccination hesitancy with the Sinopharm, when we had the Sinopharm alone, and then we had a situation in which we got some AstraZeneca from Canada, and then we saw people come out in large numbers again down in South in Sapa. And we are going to get another 33,000 from the COVAX facility that they have owed us. It's now late. It's all paid for, and we are now going to get that COVAX facility, another 30,000 AstraZeneca. Now, the good thing about that is people will now have choice, so they can either take the AstraZeneca or the Sinopharm. But do you think that there's a problem of hesitancy having to do with the Sinopharm as opposed to other vaccines?
Well, I think it's a combination of factors. I mean, one of the issues, and I think you may have alluded to this yourself in maybe a previous newspaper article, is the issue of travel with vaccines and countries and so on accepting one vaccine as opposed to another. This in itself might have been an unfortunate international development, but it is what it is. Yes, we did see on Monday, for example, with the second tranche, I believe the donation from Canada that you were speaking about of COVID vaccines. We saw an uptick on Monday, and apparently that has continued yesterday. And I believe a big part of that would have been for many of our residents, our nationals who are also residents of Canada, and we know that there is a restriction in terms of traveling to Canada. You have to quarantine. So many of those of our citizens would have opted for the AstraZeneca. There's also the issue of students who are traveling to study abroad come September, October, and they would have wanted to access the AstraZeneca vaccines. But again, there seems to be an issue of vaccine hesitancy despite the choice. And I saw some of the business chambers in this morning's newspapers speaking about choice again, and perhaps we should have, other vaccines, Pfizer and Moderna and so on, and whether that will make a difference. But the fact remains that we still have the majority of vaccines being Sinopharm. The initial rollout, I think a bit more public education could have been done. There is a study from Sri Lanka which has shown this vaccine to be effective. And I just want to deal briefly, Bhoe, with the issue of efficacy and effectiveness of vaccines and really what vaccines are about, because I think this is important for us to understand. No vaccine is going to prevent or has been shown to prevent you from getting COVID-19 infection. What has been shown is that if you are vaccinated and you get COVID-19, your chance of hospitalization or severe illness or even death seems to be extremely small. And I think this is something that needs to be explained again to the population. Because I keep hearing that, Sinopharm or the vaccine, people are saying the vaccine cannot prevent infection, but that is not the purpose of it. I mean, it is the purpose, but we need to understand the limitations of it. Also, I'm also concerned, Bhoe, because we keep hearing about the Delta variant, and we need to focus a little bit on this because, for example, in the UK, it is shown now that over 90% of all new cases are due to the Delta variant. And the USA overall, over 60%, 65% of new cases are due to the Delta variant. And of course, with the opening of the borders and so on, we know that it might just be a matter of time before the first Delta variant is here, if it's not already here.
It's already in 11 Caribbean countries, huh?
Yes. So again, keep in mind that our testing capability and capacity is limited, and that could be the reason why no Delta case has been officially announced yet in Trinidad and Tobago. But we have to operate as if it is here, or it's going to be here soon. So I just want to to make a call. I mean, I think I think there are other issues. You asked about what the issues are with vaccine hesitancy. Choice might be one, but I think there are deeper issues that need to be explored. And I think the government and the Ministry of Health, the authorities need to move quickly in terms of addressing these issues. Some of them relate to non-medical issues. They relate to religious beliefs, cultural beliefs, and so on. But surely there must be a way to meet with this and to treat with it. I'm also concerned that, especially in the health sector, and I believe that the Minister of Health mentioned this to you on Monday, that there seems to be a difference in uptake in healthcare workers, and that is something that is worrisome. Even though it appears that doctors, about 80 to 90% have been vaccinated, there appears to be some hesitancy with regards to other healthcare workers, especially the nursing fraternity. And that is something that has been ongoing for a few weeks now, and I am not sure that the steps that need to be taken in terms of addressing this have been taken. I mean, in terms of speaking with the nurses, and addressing their fears, even if it has to be in a small group or even a one-to-one basis, because they form the bulk of our healthcare workers. They're very important. I mean, I want to take this opportunity to commend all healthcare workers, both doctors, nurses, all the healthcare workers, the attendants, and so on, everybody who has contributed to this. But again, we've reached a different stage in this battle. So I think that is one of the challenges we face, with only about 40% of nurses and other health, non-medical, non-doctors being vaccinated.
Okay. I asked the minister about what they are going to do about health workers. I find it very difficult to understand why people in the health sector would not take the vaccination, will not take the vaccine. And I understand that most doctors have taken it. I don't understand why some doctors would not take it. And I cannot understand why nurses will not take it they are living in this thing. They are exposed constantly. They are seeing the devastation that it causes. And nurses and doctors are scientifically trained. They understand the value of vaccines. This is not the first vaccination that we are getting. We've had many before. So I find it very difficult to understand the thinking in the health sector. But I want to ask you, don't you think that health workers, should be mandated to be vaccinated? Do you think that is something that is desirable? You don't want to force people to be vaccinated. You don't want to force people to do what's good for them. But is persuasion the only option? Couldn't we take some decisions? The private health sector has taken a position, for instance, that they will have all their people vaccinated, or if you are not vaccinated, you have to take the test every week or every 2 weeks or something like that. Don't you think that we should go to something like that in the health sector, the state health sector, where so many thousands of people come into the system every day? We have lost his sound.
Is that any better?
Yeah, okay.
You hearing me?
Yes, clear.
Yes.
Clear now.
This whole issue of mandatory vaccination, has, reared its head in different forms and different ways in different countries. And but in regards to the health sector, now if we look at the decision, the private.
I'm just talking about the health sector workers now.
Yes.
Right.
Yeah. So if we look at the decision that the private health sector, the private facilities have taken, now this is based on the irony of patients who require surgery and procedures in a private nursing home are required to have a negative COVID-19 test before they are admitted for any procedure. So before this decision was taken to have the staff vaccinated, you had a situation where your patients, your clients, are coming into the facility free of COVID because they are COVID PCR negative, and yet you had a situation where this very staff who are interacting with them could have had COVID because they were unvaccinated. And I think this is what led to that decision. So it's that kind of thinking that, has led to the decision in the private sector. I still believe that,
No, but there are other
I still
challenges.
believe that
There are
I still
other
believe that.
Okay, go ahead, and I'll come
No,
in.
I'm saying, yeah, I'm saying, Bhoe, I mean, this whole issue of mandatory vaccination is something that we have to tread carefully with, but I believe that there's still issues that need to be addressed amongst healthcare workers, amongst the nurses. They need to be met with. They need to be, and sometimes sometimes a little one-to-one conversation is useful to clarify little issues. Sometimes they're little issues. Now, one of the things I have noted, Bhoe, and I take this opportunity when every patient I see in my practice and every constituent I see, anyone who comes in and receives a hamper in the constituency or receives a food basket or whatever assistance, I take the opportunity to raise the issue of vaccination. And one of the issues that comes about is, and this is unfortunate, is that if you have a medical condition, you have to be careful about taking the vaccine. Whereas in reality, those with the medical conditions are the ones who would benefit more from taking the vaccines. Another issue which needs to be addressed again is the perception that these vaccines have been developed very quickly. Now, the Sinopharm vaccine, which we have the majority of here in Trinidad right now waiting to be given out, the Sinopharm vaccine has been produced by the most traditional of methods of producing vaccines, which is inactivated virus being used to cause a reaction, building of antibodies, and so on. There's a lot of argument about the mRNA vaccines like Pfizer and Moderna. Those are not yet available. The Pfizer is supposed to be available for children soon, and that I know that argument will come up. But I think it's important to note that the technology behind the mRNA vaccines have been developed for many years. I think one of the confusing issues is the fact that there's so many vaccines as well, as opposed to, when you took your tetanus shot or when you took your vaccines as a child and, as a teenager, you never asked even about the brand of the vaccine. So, all of that is the issue now, how we treat with the misinformation on social media. And the question really is whether the communication from the Ministry of Health and from the government is sufficient to deal with this issue. And I am not convinced that that is sufficient as yet before we move on to speaking about mandatory vaccination.
I hear you now on the communications issue, and I hear you to be saying two things. One is that the communication effort by the Ministry of Health has not been effective enough. It has not been as effective as it could be. And you are saying also that part of the reason for that is that it has not targeted and addressed the issues that are in people's minds that create doubt and skepticism and hesitancy, and that it needs not just to be more effective in communication, but it has to be sharper in its message and in its target of the population and elements of the population that have certain things in their heads. Is that what you're saying?
Exactly. Exactly, because we need to focus, because every time I speak to someone who is unvaccinated, they have an issue. And what I found is that if you are prepared, willing, and able to address that issue in terms of, sometimes it's a minor thing, and therefore we need to have more people out there. I mean, we have this issue of so many unemployed doctors who, we have, people can volunteer, they can be engaged and so on. But really and truly, we should be out there, with a more detailed sort of campaigning, if you want to call it that, trying to reach out to those who are not coming forward to the vaccines. I have found, that with a little bit of education, that many of those who were hesitant to take the vaccine will come around to it. So therefore, the messages that we see on television about take the jab and so on. Whilst those are good and useful, sometimes they're a bit superficial and not addressing some of the deeper issues that people have in their minds. And I think this is where we need to go forward. We need to explore all of those options before we look at this issue of mandatory vaccination, because as you know, that is an issue fraught with human rights issues and so on. So I think we need to make every effort before we reach that point.
All right. One of the things that we are finding, based on the information that is available, is that there's a problem in Tobago, and I wish they would solve that problem, because an under-vaccinated population in Tobago of 60,000 people on a single island could be an explosive situation. And I have expressed my view on this show to people in Tobago: get the vaccine, protect yourself, protect the island. The second thing is East St. George. And you know St. George County, people are up and down in maxi taxis all the time. They are moving from place to place. It's an urban center. They have a problem. And the minister said that the vaccines were available in health centers. I don't understand why people don't go into health centers and get it. But the information that is available also suggests that there is a problem of low vaccination turnout in Victoria and central Trinidad. Now, this is something that I'm concerned about. I mean, I myself live in central, and I would like to see as many people as possible vaccinated here. And is there something that we can do in these sectors of the community, Tobago, East St. George, Central Trinidad, Victoria, that could increase the interest in taking a vaccine and increase the number of vaccinated?
Well, Bhoe, let me answer that question this way. And we spoke initially about the issue of the rollout of the vaccinations and so on. Now, if you note that, okay, so we have the vaccination available at health centers and the mass vaccination sites. Now, in the US, for example, you can walk into a pharmacy, you can walk into other areas and so on, and get your vaccination available. And I'm thinking that perhaps that is something we should be looking at, where you have it so easily accessible, and you also have someone who can counsel at the same time. People go to pharmacies all the time. People are going to supermarkets and so on. I'm just throwing these ideas out, that wherever the people are, you provide the opportunity in their face, so to speak, as opposed to waiting for them to go to a health center, or to a mass vaccination site. There is this issue of something called the white coat syndrome, where sometimes citizens who are well, I mean, unless they're ill, they will go to a health facility. But if they are well and they have to go for something like a vaccination, they may think that they don't want to go to a health facility. So I think we need to be more innovative. We need to look at other avenues of reaching out. I note that in some areas, in the rural areas, there's been what is being called door-to-door vaccination. That is not a bad idea in some of the remote areas. You go out. I don't know if you remember, Bhoe, in my time, perhaps in yours as well, there was something called the doctor van that came to schools when schools were open and so on. And the nurse would come out and give you the vaccination. So I think we need to be more creative. We have to look at all the avenues, because our very lives depend on getting as much of the population vaccinated as possible. Okay. So I don't think we can't just throw up our hands in the air and say, listen, there's vaccine hesitancy. And I mean, we have the public officials, the minister and the prime minister, coming and appealing to people once a week. But the question is, that sufficient? Is it appropriate? Is it even the best way to get this done? People will react and respond to those who they trust as well. So you need to have community leaders who are trusted in the various communities as well? Have these people been engaged? I made advertisements on behalf of the ministry, but have all the religious leaders and community leaders been engaged and asked and tasked with reaching out to their own communities? I can give you an example of what we have proposed in my own constituency of Fyzabad as a way to increase this. In some remote areas, the issue, I mean, people have been talking about transportation, but I don't think it's transportation in many cases. So what we looked at is through the councillors, we are looking at the initiative of getting a sufficient number of people in a community and arranging through the authorities so that, for example, if you have, let's say, a group of 40 or 50 people who are willing to take the vaccine, you use a community center in that area, or you use a church or a masjid or a temple, a situation that is non-threatening for them, and you get the healthcare worker to come out and give the vaccine. That is one approach that I am exploring in my own constituency of Fyzabad. I'm sure there are other approaches that can be used to reach out to citizens.
All right. So, well, you've said some important things there, and I agree that we need to have a much more targeted and a much more sensitive approach. I also do agree with you that the trust issue in a situation of skepticism is critical, and you need brokers in the system to help you manage the system. I think that there's a lot of value in that. And we do need to get the population vaccinated. But I want to touch now on the rest of the health system. Do you think that we've allocated too many resources in the COVID area to the detriment of the rest of the sector? You mentioned that people are not getting heart surgeries, they are not getting heart consultations. You mentioned that they are not getting cataract surgeries, etc. Now, from my knowledge, these things were existing in the health system even pre-COVID. Are they worse now?
I would say they are definitely worse, Bhoe. And I think, again, we have to look at this in perspective. Now, there seems to be the perception that some of the health sector allocation is going to COVID. I just want to make it clear that when I examine the budget allocations for the past 6 years for the health sector, and especially for the 2 years where the COVID has been with us, the actual allocation to the health sector has remained the same. It has not been cut. So we've had about 30 billion expenditure in health over 6 years of this government. So that's about 5 billion a year. Now it's important to note, and you would have been part of in your last term when special allocations were asked for in the parliament to be approved for COVID. So there are separate allocations for COVID to the RHAs and so on. So the question, I think there are two issues. One of the issues is that even though the government boasted of the parallel healthcare system, and it's a good thing that we had those additional structures, infrastructure and facilities to to organize a parallel healthcare system. But the staff, the healthcare workers who staff these facilities were not new healthcare workers. They were workers who were reassigned. So, for example, the staff at the Cuba Hospital were reassigned from Mount Hope. Those at Arima were reassigned from Mount Hope. And with the opening of Augustus Long and Point Fortinet's COVID facilities, staff from San Fernando and other areas of the Southwest were reassigned to those facilities. So that would have left a little shortage of staff in critical care. However, the issue of things like cataract surgeries, like general surgery, general surgical conditions, and so on, urology, for example, those with kidney stones, for some reason, those seem to have gone in the back burner. One of the other challenges that has not been adequately met by the RHAs is the issue of how they treat without patients. Now, we have a lot of chronic disease in Trinidad and Tobago, and that's another challenge that we'll have to address coming out of this COVID-19. But the problem is that it is what it is, and those patients now are suffering badly because they cannot access, in many instances, we're talking about diabetics, we are talking about those with kidney failure and so on, who need their treatment, who need consultations on a regular basis. And I am not convinced that at this stage of the pandemic, that the authorities, have put in place effective measures for these patients to have their consultations. And they're suffering. The diabetics out there are suffering. Those with, kidney failure and so on are suffering. The cardiac patients. So we need to examine whether, in fact, we have a true parallel healthcare system and whether the boast of not interfering with the regular health sector is true. I don't think it is true. I think it is worse now than it has ever been, and we are seeing that. To say that we've taken away resources from the regular health sector to put into the parallel healthcare system is not entirely true. There have been separate allocations of millions over the 2-year period, several hundred millions that has gone specifically to COVID-19. I remember specifically in this last budget media review, which would have been in June, specific allocations going to the RHAs. So then why has the regular health sector, why is that suffering? Is it poor management, at the level of the RHAs? Is it poor direction by the ministry and the Minister of Health? I think these are questions that need to be answered.
All right. So you are saying beyond the COVID challenge, the effectiveness of the health sector remains, and it is a problem. It is not well managed, and it is not reaching the needs of the population that require health services.
Yes, I think the regular health sector has suffered badly, and this is unfortunate in view of the fact that we do have the facilities for parallel healthcare system. In other words, if we did not have those facilities, Hoover Hospital, Point Fortin Hospital, Arima Hospital, Augustus Long, if we did not have those separate facilities, and all patients had to be managed in the regular health system, then one could have understood. But we had those separate facilities, and therefore why have we not been able to maintain proper service in the health sector? Now, I know the counter-argument will come that certain precautions had to be taken and so on. And whilst I appreciate that had to be done in the early stages of the game, perhaps in the first 3 or 4 months, surely the world experience would have shown, and surely we should have evolved and developed mechanisms and so on to treat and deal now in a different way, as other sectors are doing, as to how we maintain normal business in the public health sector.
And I will add to that vaccination of the entire working health sector employees at all levels would help, and screening of patients before they come into the hospital for COVID would also help to strengthen the public health system outside of the COVID pandemic. I want to... Sorry?
So before we leave this issue, I think that has been one of the challenges, and it would be remiss of me not to point that out. I know in the regular health sector they have faced challenges because, rightly so, doctors will not want to do a surgery or perform a procedure on someone whose COVID-19 status is unknown. But there has been challenges in terms of the rolling out of testing, and the rapid antigen tests, has only been made available recently when it was promised a long time ago. So those have been some of the issues as well. The lack of the testing facilities for patients coming in for surgery and so on.
I'll ask you 2 questions.
But I hope those are being addressed as we speak, yes.
Yeah, I will ask you 2 questions. I need rapid responses, quick responses for them before we go. 1, just a yes or no answer. You think we're prepared for the variant when it gets here?
Boy, I don't want to give a yes. I don't want to give a yes or no answer for that. I am an optimist, and I would hope that we are prepared. But the truth of the matter is, I would have to say, I hope so. That would be my answer. I mean, I'm not privy to what the preparation status is on the inside, but yeah, I would want to hope so.
Yeah, and a quick
But I keep my fingers crossed.
right, another quick question. I mean, the World Health Organization is an arm of the United Nations, and it is subscribed to by all the nations of the world. And they are entrusted with leadership and management and coordination of global health care, with an emphasis on the poorer and developing countries, etc. They've done a good job so far, but in this COVID thing, we have a situation where they have identified 5 vaccines, which is AstraZeneca, Moderna, Pfizer, Sinopharm, and Sinovac. Do you think it is right for a country arbitrarily, which subscribes to the World Health Organization system and supports it, do you think that it's right for a country to arbitrarily decide that it will only take some of the vaccines that the WHO has approved?
Well, the question here, Bhoe, is really and truly now, as we both agree, this is unprecedented times. Now, what is important is that WHO is a guide. WHO guidelines are there for every government, but at the end of the day, a government should not hold itself bound strictly by any international organization. You have to look at your own factors. You have to look at your situation in the country, and you have to do what is right based on your own local circumstances. I'm not sure what. Do you want to ask me that question again, Bhoe? I'm not quite sure where you were going.
Well, just I don't have the time now to ask it, but in the sense that, they've identified 5 vaccines, but a country wants to pick out 2 out of the 5 to say those are acceptable, but the other 3 are not. I find that untenable. Either you have a whole body or you don't.
No, I agree with you. I agree. You can't pick and choose. And more than that, sometimes you may have to take the decision of choosing something that may not necessarily be yet, approved by a world body based on your own personal circumstances.
That I can understand. That is taking national responsibility. It's not violating the international precedent. Anyway, thank you very much, Dr. Bodoe. It's been a pleasure having you and to have a discussion with you here this morning. I hope you'll come back. We go on now to the news with Chanel Al-Suran.